Welcome everyone to Funding Opportunities and Considerations 101. My name is Noah Siegel, and I'm the manager for evaluations and special projects with the Native Center for Behavioral Health. And I am filling in for the PTTC project manager. We are in the period of transition, but we shall be announcing a new PTTC project manager sometime in the very near future. Next slide, Pam.
Oh.
Do you have the PTTC map and the SAMHSA?
I am so sorry. I misunderstood.
No problem. Here, I can do it.
You
real
got
quick.
it? Okay, good.
Yep.
Because it'll take me a minute. Thank you. Sorry, y'all.
Go. So just pull this up. This event is brought to you by the National American Indian Alaska Native Prevention Technology Transfer Center, which is located here at the University of Iowa. We are part of a national network. There we go. This project is supported by SAMHSA, and the content is developed by the presenter, and the opinions expressed do not necessarily reflect the views or policies of SAMHSA, HHS, or the American Indian Alaska Native PTTC. Following today's event, we'll send out a follow-up email, which will include links to the presentation slides and recording, if applicable, information about how to request or receive CEUs, and the link to our evaluation survey. And now I'd like to read the land acknowledgement. We'd like to take this time to acknowledge the land and pay respect to the Indigenous nations whose homelands were forcibly taken over and inhabited, past and present. We want to honor the land itself and the people who have stewarded it throughout the generations. This calls us to commit to forever learn how to be better stewards of these lands through action, advocacy, support, and education. We acknowledge the painful history of genocide and forced occupation of Native American territories, and we respect the many diverse Indigenous people connected to this land on which we gather from time immemorial. While injustices are still being committed against Indigenous people on Turtle Island, today we say thank you to those that stand with the Indigenous peoples and acknowledge that land reparations must be made to allow healing for our Indigenous peoples and to Mother Earth herself. And this was written by 3 members of our staff. Next, I would like to turn it over to Shirley Kane to start us off in a good way with one of her prayers. To Pam Baston. Shirley, I don't know if you want to introduce Pam or she can introduce herself.
I can introduce her. I'd
Make
like
it nice, Shirley.
Huh?
I said, be nice.
Always.
Kidding.
I want to say something different other than, this is what she's done all these years. I want to introduce her in a way that I know her, and I would like to introduce Pam Baston. And since I've known her and since I've met her, she's an awesome person and is always a good support and a fantastic guide for whatever project we're working on. And I've been really honored and humbled to be working by her side and to do the things that we've done. I'm just like, I can't say enough about Pam and all that she does. And she, as far as diversity, equity, and inclusion, she just gets it. And she doesn't have to be told this is how it is, or doesn't have to read. She just knows it. And I'm really grateful for that and all that she does for our people and for other people that really need it. And she loves the world. And I'm really glad she does, because it makes her so kind and so compassionate. So here you go, Pam Baston.
Well, thank you. Thank you. Very, very sweet. I appreciate that. It's a pleasure to work with you, Shirley, every day, and a pleasure to work with the rest of you. I do have a quick technical question. Is someone going to pull the PowerPoint up? I came in from a medical procedure within minutes of this starting, which is why we had a little delay here. So Noah, do you pull that up or do I go back and get my PowerPoint?
Yeah, I thought I could pull it up, but you want to share your slides, you can do that right now.
Okay.
That was my understanding. But
So I
either
should-
way, yeah,
so
you
I
pull it
should-
up.
Okay, I'll pull it up. Okay, so welcome everybody. And what we're going to do today is we're going to cover what is a 2.5 day in-person course in about an hour and a half or whatever we have left. And I realize we are over lunch for some people. And I need to do full screen, right? Is that it?
Yes.
Okay, so basically this is going to be a strap your seatbelt on kind of situation, where you'll want to make sure that it's not doing full screen. Isn't that weird? Let's try, here we go. See, this will do it. It won't get the little side strip out.
Let's see, do you have it open at full screen in another window, perhaps?
Oh, I don't know. Golly, I think you might have to do it.
Yep,
No, because
no
I really
problem.
I don't know what's happening.
No problem at all.
Well, I'll just do a little introduction while y'all are doing that. So 2.5 days is what it takes in person, and we break out into groups and we practice different things. And so you really leave with a much better sense of how you actually implement this. But while this is getting pulled up, I want to say that I've been in the field 42 years and have pretty much written grants almost, maybe all but about 7 or 8 years of that 42. And I've been a federal grant reviewer. So I learn what works, what doesn't work, what do grant reviewers like to see, what don't they like to see. And that's the kind of information that I will be sharing. On a part-time basis, I literally have within maybe a 6-year period. Oh, that didn't pick up. Okay, that's fine. Within a 6-year period, I brought in probably $100 million in funding, just doing it on the side for different tribes and organizations. And so the techniques I'm going to share with you are the ones that I have found successful. I probably get about 90% of the grants I write. So that hopefully will be of use to you in this effort. And so can we go to the next slide or do I? Okay, so we're going to cover 3 basic things. One is, what are the things that you can do before you even know that there's a grant opportunity out there? That is, to me, if I could convey maybe 2 or 3 secrets of the trade, one would be you never wait until a grant opportunity drops. Drops is the word we use, that it's live, that you're able to start writing to it. That if you wait till that happens, your chances go down considerably because you just may not have enough time to pull the information together in a thoughtful way, and sometimes you have to put these things down, pick them back up a couple of days later to read them with fresh eyes. All of that careful sort of review again and tweaking and polishing and all of that. You may not have that, but your competitors who started earlier may. So I'm going to talk about a process where you literally write or prepare parts of the grant long before it even sort of drops or hits the street by using some techniques I'll be providing here. And then that way, if you have part of it written, once the grant opportunity drops, you will have a lot of work already done, that you can then just edit to fit whatever the exact requirements of the grant that you're applying for have put forward. And then we'll cover very briefly at the end, what do you do to keep your grants funded project sustainable? What are some of the things that you should consider to keep it in a sustainable mode? Next. So quick trick question: when should you begin writing a grant? Feel free to put your answer in the chat box. And I am going to be moving pretty quickly through this just because of the huge volume of material that we have. But you will get a copy of your slides. Trick. So here's the answer. The minute that your tribe identifies a need that or a wish list that you would like to get funding for, is the time you begin this process that we'll talk about. The reason this is important is that the submission timeframes can be as brief as 10 days. Sometimes it's about, the average is probably a month to 6 weeks. That's assuming you find out about it the day it drops, all the way, to the day you submit. And that's really not a lot of time, because remember, most of the people writing these grants are also running programs and dealing with whatever's happening in their tribal community, and they're usually very busy, and so therefore you're doing this at night and on weekends, and so a month time is really even not very much to write unless you have a dedicated position. So get ready. Here's the things we'll cover. And we're going to cover just a handful of grant terms. We're going to do that pretty quickly. I'm going to show you a couple funding links that you'll find out some funding sources to look for. We'll talk about the importance of identifying local data and information to support your tribe's needs. We'll talk about getting partners and champions and identifying effective practices. And these are all things getting ready, like you see this woman stretching, she's getting ready for her big long marathon. And these are the things that you want to do now, getting ready before a grant drops. Next. So we're going to cover real quickly just a handful of these terms now. So know that every funder has different acronyms. It's so confusing and so maddening because they all basically mean the same thing, but nobody uses the same language. So just a few that we'll cover. One is the Catalog of Federal Domestic Assistance, called a CFDA. Every grant that comes out has a different CFDA number. So there might be one for homeless grants, a different one for HIV grants, a different one for youth grants, pregnant women grants. So it's just a code, if you will, that identifies the funder and the type of grant that it is. The FOA is a funding opportunity announcement. That is what SAMHSA uses right now. They used to use other terms, or they also now use notice of funding availability. But what these terms that I'm going to show you here mean is basically that there's a funding opportunity out there to which you can apply. The little distinction here, if you see the ITA, intent to apply, and ITN, intent to notify, this is very interesting. So what normally happens is the feds will put out a funding opportunity, and you may kill yourself getting this grant written, only to find out at the end, when you get the feedback that you didn't get the grant, why, that really you weren't a match. What you offered is not what they were really looking for. And yet you've spent all this time and energy, and you've got your partners to the table, and it's very frustrating to not get it. So many funders are now adding an additional step that makes your life a lot easier. And that is, they will issue like a preliminary notice, to say, hey, do you intend to apply for this or not? And you respond with maybe like a 2 or 3 pager that they'll tell you what to put in it. And then they weed out or in the proposals that look like they're more on target. And then if you're selected at that, they give you the green light, then you write your long grant and you get all your partners together. But it's sort of a way to kind of run something up the flagpole, if you will, to see, is this going to match up with what the funder is looking for? And it's a time saver, even though it doesn't sound like it, because it's one extra step. It's better than writing a whole grant only to learn you didn't get it or you weren't in the ballpark. Next. And then these last terms are just different ways different funders will name their funding opportunities. Notice of funding availability, a NOFO, notice of funding, availability or opportunity, request for application, RFA, or RFP, request for proposal. These are just different terms. The last one here, the supplement announcement opportunity, sometimes called supplemental announcement opportunity. If you see that, it's very important to read it carefully, because usually that particular funding type is only available to people who already have funding for something from that funder. And so let's say you got funded to do an opioid prevention program. Then the feds might have a little extra money, and they say, oh, why don't we add some money to the current cohort, the current group of grantees, and let them also address stimulant use. And maybe we don't have enough money to fund all the grantees that have opioid money to now give them stimulant money, but we have enough money to fund maybe half of these grants. So the only people in that case that will be eligible are the people that already have funds. And what they do is they amend your budget and kind of slide this extra money in. So supplemental money is fabulous because it's easy. It's usually quicker in terms of how soon you get it. And sometimes it's a much briefer process. But again, if you're coming from the outside and you don't have the funding already, you won't even be able to apply for it. So really these grant announcements, all these words that we're talking about here, really is what sort of gives you the directions of what you're to provide in an application. Next. Okay, so what we're going to call this is pre-work. What's all the work you do long before the funding opportunity kind of hits the street or drops? Next. So these next two slides we're going to cover very quickly because they're very boring, but it just has to do with, you know, that if you're applying for federal funding, you have to register. Many of you, if you've gotten grants before, you're probably in the system already. You've probably already registered, but it's a quick process to put the information in, but it takes in grants.gov about 1 to 3 weeks for them to approve you as a potential applicant. Once you get that status, I don't know if you're golden for the rest of your life or for a period of years. They'll tell you that when you apply, but it's something you don't have to redo all the time. That's good. It's very quick. And that's for most federal grants. This is what you would do. You would apply to get this, you know, to just register and have them recognize you as a potential applicant. And then the next slide, you'll see that if you apply to SAMHSA, the Substance Abuse and Mental Health Services Administration, there's an additional step, a one-time registration on top of the other one. That takes about 6 weeks. So what if you've never written a grant before and you only have, you know, 6 weeks to apply for something and you still have to do this registration process, you're kind of cutting it close. So, but the good news is I've given you the link so that you can, at your leisure, read all of this fun-filled information about how you apply to make sure you get it all straightened out before you submit any kind of a grant. This I cannot recommend enough, and I've given you the hot link here to it. This document is so amazing, and they've updated it in the last couple of years. It's even better now. If you are applying for a federal grant through SAMHSA, this walks you through what are they looking for in every single section of the funding application. But the information is so good and so generalizable that you can use it for other grants as well. So even if you're intending to apply for, you know, funds from IHS or from a state or from a county or some other group or Department of Justice or whatever else, this will be very helpful to you. So I highly recommend. Has lots of samples, lots of examples that will help you. So we're going to learn now about funding resources. What are some of the funding opportunities? And oh, Noah put that in the chat, the hot link in the chat. So that's good because you'll be getting this, I believe, in a PDF and it won't be hot for you. So that's good. Won't be live. Okay, let's see what some of the funding resources look like. And I only covered some of the few major ones. First of all, this is what's called a funding opportunity forecast. This is fabulous when the feds in particular, and primarily I'm discussing here federal grants, but they and other funders may do these as well, but most federal funders will put out what's called a forecast. Nothing's live, you can't apply yet, but it's sort of like coming to a theater near you, you know, click here and you can learn about the homeless grant we're going to fund or the HIV grant or the pregnant women grant or what have you. So this goes on for pages. I'm just showing you a brief thumbnail, but what's cool about it is you can click on it and get little descriptions of what it is so that you can start thinking months in advance. Okay, listen, we need to get ready. If we want to, you know, we have 10 things we can apply for. What is it that meets our tribe's needs? Pregnant women services, youth, you know, prevention, recovery support. What is it? And then see if it's a fundable category. And it also will tell you usually how much money they're going to be and how many awards they're going to make. So this is a very helpful thing, and it gets you thinking and planning in advance. So let's look real quickly at these funding sources. What I recommend is that you, in your leisure, because we know we all have so much of that, that you just click on some of these federal funding sources and learn about them well in advance of funding opportunities, so that you can get a sense of, do your tribe's needs align more with justice initiatives or health initiatives, or behavioral health? What is it that these funds, what's priority for you? Oops, wrong way. There we go. So Department of Health and Human Services, what I give in these next 4 slides is the umbrella organization. So under the Department of Health and Human Services are a myriad number of centers, like SAMHSA, the Substance Abuse and Mental Health Services Administration, and under it is one for treatment, one for prevention, one for mental health. Also under HHS is the Administration for Children and Families, which is like runaway grants and child welfare grants. And so there's lots of others here under the umbrella. So if you go click on this link, you can see all the different groups that are awarding funds and see where you fit, or where you want to start your grant writing journey, where you have the best alignment. And we can just go real quickly through the next. There's one for justice, one for agriculture, one for education. These are just a few, and there are others. But these links here will help get you going in the right direction. There's for IHS and so forth. So this is the time to check these out. When I ran programs, I would always assign a staff and say, okay, Ren, your job is to, be on top of anything that comes out of HHS. And Steve, you've got to look for Department of Justice funding, and you kind of assign people a different content area, because there's so much you have to weed through that this is kind of an efficient process. This last paragraph, you can hire. Some of these are free, but some you have to buy, and they're a service. You can pay, a few $100 a year, and they provide a service for you that will go out and find the funding opportunities that line up with your priorities. So it's sort of like, I feel like it's like, what's that game I'm not good at? I think it's like Jeopardy, where you like buy a vowel or you buy a consonant. And so what this is you buy words. So they say, and I'm making up this amount, it might be like $300 a year, and you get to buy sort of like 10 words. So you might say, our tribe is interested in, and I'm making this up, runaway, HIV, homeless, telebehavioral health, recovery support. You give them the words that represent the types of funding you're looking for. And then when you come in every day at work, there'll be an email. Here's what we found today, or hey, nothing today. And they give you the links, and then you've got to do all the work to find it, but they sort of narrow your search. And if these are still a few $100 a year, that they may be very much worth it to you. Just pick your words carefully. And then also there's a couple free, I think, Grant Gopher and Chronicle of Philanthropy. A lot of this kind of stuff changes. I'm sorry, those are the ones that have a cost. The free ones are Philanthropy News Digest or something. But this changes a lot, whether it's free, whether it's not, which ones are good, which ones are not as helpful. So you have to do a little research, because this evolves constantly. So the other thing, and this some people might have trouble with, but your competitors are doing this. So what happens is, when you write a federal grant, it becomes what's called the public domain, meaning that anyone can get access to what you wrote, with the exception of proprietary information, which is primarily your budget and a few things, maybe some other attachments that will not be made public. But your grant narrative about what you're going to do and how you're going to do it is public. And that's called the Freedom of Information Act, or FOIA. And you often in the past, you would have to pay, I think it's $1 per page for them to, for the feds to copy it off. And then they would you would pay like a mailing fee. Now it's all done, of course, electronically. I don't know if they have a small fee, what they call cost recovery. In other words, just to kind of help compensate for the staff time to go do the research to find the grant copy that you requested. But in my view, this is very well worth doing. The issue is that you cannot just say, send me all the grants that got funded in this year, or send me these 10. You have to specify. I would like, the Yurok tribe proposal for homeless submitted, that was submitted in December of 2021. I made that example up, but in other words, you have to be specific. So you might say, well, how do I know that? How do I know what got funded? Well, in SAMHSA anyway, and I believe most other federal funders, they have what's called an archive. And you can usually access it online, and you go find out, well, who got awarded this funding? And it will give you the names of the organizations or tribes that were funded. And then now you have what you need to get a copy. So you go back to the funder and you say, of the 10 adolescent grants that got funded in 2021 by SAMHSA, I would like a copy, of the Seminole Tribe proposal, the DACO drug treatment proposal, and, XYZ. And then they will send you those. So you just have to do some research, some surveillance, kind of work to get those, but it's worth it. Also, again, we're still in the pre-proposal, the pre-work part of your job, which is getting ready. Okay. So consider becoming a grant reviewer. This is a link of how you would become one for SAMHSA, but every federal agency has a different way. Almost all federal agencies hire out their grant review process to people such as yourselves. It's called a peer review. In other words, they're not typically reviewed by federal staff that will then oversee the program. It's done sort of independently by outside people. They're usually paid between $350 or so average a day, or for an 8-hour period. They send you they give you some training. They send you the grants electronically. They give you score sheets, and you have to score them. Obviously, you cannot be a reviewer on a grant that you submitted. There's rules around what you can and can't do, but it's a really good way if you're serious about getting in to be a grant reviewer, a grant writer, and especially if you're new at it, you might want to become a grant reviewer first. You will learn more in that than in anything else you can do. Next. Okay, so we're still in the pre-work. So now we're going to talk a little bit about gathering the data or the information that you will need to make a strong case for why you need the funding. You're going to get that from two different places. One is from existing information. There is a wealth of information, courtesy of the internet, that you can get to really make your case almost down to your not always at your tribe's level, but at least at that region of the country you live in, or within the state that your tribe is located, or within a few counties, because the data is pretty much available these days. So that's what we call existing or archival data, meaning somebody already gathered it. It sits somewhere in a report, on a website, in a map. Then there's the data you initiate, which is when you go out into your tribal community and ask questions of elders, or of what we call key informants. And if you're not familiar with that word, you might want to write that down. Key informants. Sounds very sophisticated. All it is people in the know, people that observe things, that know things. Key informants might be a head of a public housing authority, like the property manager or the resident assistant person. Might be the senior law enforcement officer, or even just basic law enforcement in your community. Might be a tribal judge, might be the head of your, child welfare division, or what have you. People that are in key spots that have information about what you are interested in. And do not forget to ask people who have lived experience. So if you're looking for somebody, if you're writing a grant on substance use, you might want to talk to people who have had a substance or still have a problem with substance use to find out what do they need? How do they see the problem? What are the solutions? Or people that are in successful recovery. Hey, what worked for you? What didn't work? What do we need to do differently in this new grant we're going to apply for? And make sure you then, when you write the grant, let them know that you took the time to get the voice of the people in your community, including people with lived experience. So that's sort of, you get existing information and you get new information and you put it all together, you weave it all together to tell your story. By the way, and you can go to the next slide, the process of identifying your needs is what will help you figure out what partners you need. Are you able, when you figure out what all the needs are in your tribe, then you say, do we have the capacity ourselves to do this? Or do we need, experts in child welfare or experts in the school system? Or do we need to have other partners that criminal justice or to give us access to these key populations we're going to be reaching out to? So that will help you. So, oh, sorry, go back one. So here's an example of the kinds of information that you might want to be getting. And I'm using some substance use and mental health examples here. The number of opioid overdoses or the hepatitis or health disparities and barriers that individuals in your tribe might be experiencing. The external data will come from, like I said, state, national resources, waiting lists. Waiting lists are very powerful. That's probably the number one thing that will get a federal funder's attention. Their biggest fear is they're going to fund you for something and you're not going to have a pipeline. That's another word you might want to write down. Pipeline. When you think of a pipeline, what do you think of? It's like this massive pipeline of information coming your way, or clients, participants coming your way. Nobody wants to put a lot of money out there, and the feds have done this, put out millions and millions of dollars, and then have just a small number of people show up for care or for prevention services or programming. And so when you say, hey, we have a waiting list, or the people in our community have waiting lists, and so we're going to start the new program so that we can take all these people that aren't able to get in for any services, that shows demand. That shows ready access and demand. So anyway, and as you're gathering your data, if you can try to stay within the past 5 years or more recent, that's better, because the world changes so quickly year by year. I mean, look what happened with COVID. It's a different world now than it was 2 years ago. And so those data points change very rapidly, and the more current, the better, but try not to go back more than 5 years. And if you have to go that far back because that's all you have, please make sure you put a little parentheses. You put a little note. I always write, by the way, I always write my proposals to the grant reviewer, because if I don't get past the reviewer with a good score, it doesn't matter what I have. So I'll say grant reviewer note. These are the most recent data available on this topic for our tribal community. So they know, yeah, maybe 3 or 4 years old, but that's the most current. We're not giving you old stuff. It's that's what we have, the most current. So they don't know that when they see, wow, that was back in 17, like the world's changed. Yeah, but that's our latest. So next. So this is fascinating to me. And one of the things I learned as a grant reviewer is how important visuals are. Imagine a grant reviewer getting 10 grants, pages and pages of narrative, just like major text heavy, and you're trying to read it. And by the way, most grant reviewers have full-time jobs. That's what makes them relevant, right? Because they work in the field. So now they're reviewing the grants at night, on weekends. They got kids, they got a lot going on. After a while, all these grants start looking the same. And you're like, oh, wait, did I just read that in this grant? Or was that the one I just put down 10 minutes ago? It gets confusing. So graphics, charts, graphs, things that get their attention, that can sort of at a glance make a point, is critical. So this is American Indian Alaska Native overdose data. And you can see where there are high concentrations of overdose. And the link of where this is in the notes pages, and I'll make sure I get that to Noah for posting. So, and I think this is 2019 data, which was the most current for this. But anyway, you can certainly see where we're having opioid overdose problems. You can get overdose data by fatality versus revival. You can get it by what what the drug, when they overdosed, did they overdose on a stimulant or an opioid or something else? That's usually gathered at the coroner, and it's not available for every tribe. You have to, I believe, join what's called OD mapping, overdose mapping. And so, but the information about that will come to you after this. This is, if you haven't already gone to this resource, and I show it as 2018, it was really the 2019 is the most current one. The link here is to the 19, but I have a new Adobe Acrobat. I'm so bad with whatever the software, and I could not get it to do the snipping tool, like to take a picture of it. So I had to use my old picture but it looks exactly like this. It just has a 2019, and you can get all kinds of fascinating data specific to American Indians and Alaska Natives around substance use. And they also have some on mental health. And what you can do if you don't have data for your tribe, or your tribe is very small and you don't have the capacity to gather data. And I'm gonna, put this in very basic terms. Let's say that you open this presentation and you get to a chart that tells you in 2019, 10% of Native Americans that are 18 above and older had a need to get into substance use treatment based on the severity of their drug problem. Okay, that's national, countrywide data. But if you know that 10% in the whole country, you can say, okay, we're going to apply that 10% statistic against our population. So you say, I may not know what the drug problems are in my tribe, but I know how many 18 and up people I have. And I have, let's say, 1,000 people that are 18 and up in my tribe. I'm going to apply that 10% that came from this study against, and I'm going to say that means I have about 100 people right now who are 18 and older who need treatment. But you must disclose that. So you say, while data specific to my tribe on this data element are not available, if I apply the national American Indian Alaska Native data against my population, we would estimate to have this amount that would need treatment in our area. So there are ways to use the data specific to American Indian Alaska Natives in your own tribe. I think they call it a synthetic estimate. Okay, here is just a reminder that we have fabulous tribal epidemiology centers out there that gather tribe-specific data or regional specific data for American Indian Alaska Native people, and that they should be able to help direct you as to the resources that are available. I can't remember how many of these there are, but they have, I think at least 10 or 12 of these regions in the country. And so you have to find out the one closest to you, because that would be the most relevant data for your area. Next. So here's an example of gathering your own data. You just get a few key questions together and you go out and talk to people and you write down what they say. Doesn't have to be complicated. It does help to have the same questions asked of each person. The reason that's important is then you can add them all together and say, let's say you did, 20 interviews. And let's say, of the 20 interviews, maybe, 10 told you the same thing. You can say, in the people that we interviewed, half of them identified as their top problem or their top strength, XYZ. So this is just taking, and I'm big on quotes without putting who it was. If somebody says something to you that's really compelling, like somebody told me recently, it is easier to order any drug you want in my tribe than it is to order a pizza. And have it delivered, literally, to order up drugs, any drug you want, and have it delivered easier and faster than getting a pizza ordered. Well, that really got my attention. And so I'm kind of an average person. So if you hear some testimony like that, use it, put it in a little text box, because that you can put all the boring data. I shouldn't say data is boring. I'm sorry, you didn't hear me say that, but all of that that you want. But something like that, you're going to remember, and you're going to say, holy, you know what, we need to get some help there quick, because they're in trouble, so you want to make sure that you show urgency and compelling information. So this is just some examples. And I did put, by the way, you don't need to go back, but in that last slide, there was a word about, perception of care. If you are running any programs at all in your tribe that you're working with, and you are not gathering what we call perception of care or perception of services, it's sort of like what you used to call client satisfaction surveys. Even if it's just 3 or 4 or 5 questions, you're really missing an opportunity, because not only do you want to show that you care about the people that you're serving, but that you ask them, you care enough to ask, hey, what worked for you here? What didn't work? What do you wish we could do differently? What was the best thing that happened to you here? The most effective thing? And then you look at those at the end of the year or every how often, and you pull out key statements and quotes and bits of information that you weave into your story, because that's really all a grant is. And why I think I get a high success rate is I like to tell a story. I don't just throw together a bunch of random stats, statistics, and I try to make it very compelling and interesting, and try to put the grant reviewer right there, because that reviewer may know nothing about your tribe, may not even know where it's located, they may have no idea what to expect. And so, you've got to make sure that you spell it out and think about all the things that have happened. There are 12. Thank you. There are 12. Thanks, Shirley. 12 epicenters, tribal epicenters. So they're just all over the place. And they're not quite all the same. So, you just have to speak with them and figure out what they can offer you. There's a lot of things that happened with that isolation during COVID. So you also want to make sure that not only do you have the data and the story, but that you update that story with things that are happening. Like COVID. Think about those kids, for example, that didn't go to school for 2 years, and the amount of how behind they may be socially, academically, how depressed they are from the isolation, how that fuels mental health challenges, drug use, and so forth. And so making sure you work that in. And this is about gaps. I love this slide because it's showing, I had to look at this for like, what the heck is this? But it's a snail, like bridging the gap between these 2 rocks. And so that's you want to fill the gaps in your community with grants. That's what they're generally used for. So find out, there are consequences associated when a person that needs mental health or substance use help or physical health help, and they can't get it in a timely fashion because the programs don't exist in your community or they're full with a waiting list. Well, that costs, there's a lot of cost associated, like emergency rooms get filled up. There's fatalities, there's, hospital costs go up, even like, for example, people that inject drugs, if they don't get, if they're not getting help, they can develop severe infections that can end up in hundreds and hundreds of thousands of dollars of heart surgeries and all kinds of medical treatments and things. So your goal is to prevent as much as you can. So find out where your gaps are, make the case that, when these problems aren't addressed, we have increased violence, we have increased child welfare, we have increased issues with hospitalizations and medical costs. So then you use all of that information to figure out, well, who do I need as a partner? What, either new partners or strengthen the existing partnerships that you have. And so, some of you might have the capacity to do a lot of this work yourself. You might need some help. And the feds typically don't like it when you operate in a vacuum. They do know that it is usually better. Usually no one group of people can solve everything themselves. They usually need help, partnerships with others. So it's always good to have partners, even if maybe you don't need them. Some tribes need them more than others, but at least hopefully try to have one in there. And so but the feds also know that the more groups you have involved that start relying on your new program, the more likely that program will be to be sustained. Because, imagine you've got this pipeline of referrals coming to you to keep kids out of child welfare or to keep kids from dropping out of school or what have you. And suddenly your program runs out of funding. They're going to feel the pain because they're used to getting lots of help from you. So having those partners in, they become your advocates for additional funding, or they might have funding themselves that they can give you. And so that's really important. So, who do you have trust with? Who can you work with? And who mutually benefits. So my best example is that I was asked to run a program in public housing back in the 90s, mid 90s. And it was a drug program that was in public housing. And I said, well, first, and it was, I wrote the grant and they got it. It was $1.2 million a year for 5 years. And so I said, well, I wrote the grant for African-American and Hispanic Latina women and their families, and I'm neither of those. And I wrote them for the groups that were not getting good service in that area, and also women who were gay. So I said, I'm not those. And I've been poor, but not in public housing and not for an extended period of time. So I'm really not your person to run this. And so then they almost had to give my grant back because they couldn't get anyone to run it. So finally I said, tell you what, move me into public housing where I can learn, then I'll do it. And they did. Be careful what you ask for. So there I was living in public housing and sitting out on my porch stoop, learning everything things I had no clue about. Well, from that, I noticed that these women, well, I worked with whole families, lesbian partners, men, married couples, unmarried, whoever, all their kids. We served them in public housing apartments, however their family identified. Most successful program. I think it was the most successful in the country then. I still think that 30 years later, 27 years, whatever it is, it was still better outcomes than what we get today because we serve the whole family, which is really where we should be anyway. And what happened is I started noticing that these women, primarily they were single moms, but there were some dads, would leave in the middle of the night and they'd go to the hospital. Every time their kids would get sick with a fever or something, they'd go to the hospital. And that's when I realized, oh my goodness, they don't have primary care. They don't know how to get a pediatrician or how to afford it or how to get, preventive care. So I made a deal with the hospital. We figured out how much was the hospital spending on indigent care in their ERs. And I got them I said, you know what, I'll work on a plan to keep these kids out of your ER, but I need money to hire a nurse on staff to do that. They gave me enough money. I hired a full-time nurse. She ran groups every single day on well care, well-being, how to keep your kids healthy, what the vaccination schedules are, what to do if they have a fever, kept them out of the hospital. So that's an example of how do you leverage, because when you provide a program, sometimes the benefits don't accrue to you, they accrue to other systems in your community. And they should have a stake in what you do. So you can go to the next slide, but have coffee, have open houses, do whatever you can do and we like to feed people from the South. And that's, if you don't offer food, you generally don't get people to show up. So, we would have tours of our program, and we taught our clients how to prepare meals, we had little challenges like how to prepare a week's worth of food for your family on $50, and you have 4 or 5 kids, and how to make today's hamburger into tomorrow's, stir fry or whatever. I mean, we did all kind of things. And we then would serve some of that food and the clients would come out and show what they made and how they made it. And our funders could not get their wallets out fast enough because we really gave them the full experience that we wanted them to have. So that's very helpful. Next. Okay, develop or strengthen your partnerships through memorandums of understanding, memorandums of agreement. I'm not an attorney and I did not stay at a Holiday Inn Express last night, but I believe that the memorandum of understanding is has more legal teeth, where a memorandum of agreement is more casual, but do check that out. But what the feds and funders like about these types of agreements is that it formalizes what are you going to do? What is the school system going to do, or whoever your partners are, so that the program will more likely stay on track so that it wasn't your idea of what they were supposed to do and they have a different idea. It's all written down. It's all signed. And, we always put out clauses to make sure these weren't legally binding. Otherwise, nobody would sign them. So we would say, either any partner can get out with 30 days notice. But we would say what those are. Sometimes your partners are only providing you access to your population of focus. We don't say target population anymore. We call them population of focus. A population of focus is simply the group you are serving. Is that 0 to 5-year-olds? Is it teenagers? Is it all youth under 18? Is it families? Is it elders? Whoever it is, your program will be serving is your population of focus. And you might have partners that do nothing but provide you access. So for example, if you were going to serve kids in the justice system. I know we're not supposed to say criminal justice anymore. It's full-time job staying on top of the language, but justice. So kids that are in the justice program. So you might go in to a center, like maybe a delinquency center or a program where kids are committed in the justice system, and provide counseling or provide some kind of life skills within their institution. Because, right, you have a ready-made access, they're sitting there and they can't go anywhere, so they're going to get whatever you provide them. Well, that's worthy of an MOU or MOA, because even though all they're doing is say, come on inside, come to our school, come to our center, provide services, that's a really valuable, valuable tool or gift to the project. And and sometimes it's space. You get to come in and use an office, or sometimes they're going to provide you the transportation, or they're going to agree to sit on your advisory council. So there's always different ways partners can participate, some in small ways, some in big ways, but it needs to all make sense. Also helps to find champions. Champions are people like cheerleaders on your program or on the work that you've done, because you can get them to, sometimes they can send a letter that will invite people to come from the community to meetings, and they're more likely to come if the person that's a champion sends a letter than if a regular staff member does it. Sometimes they can talk to policymakers and funders on your behalf and say, listen, I'm the school superintendent, and if it weren't for this program, I'd have 20% higher dropout rate. So you want the champions too. They may do nothing else but put out the good word about what you do, but it's a critical group to have. Next. Okay, so we're just sort of getting started. All of that is pre-work. Notice none of those things were done in response to a grant dropping for you to write to it. All pre-work. We're still sort of in pre-work, but now we're going to get rolling with a little more information, a little more specific to the funder. So we're going to pull it all together here. We're going to talk about goals, objectives, and so forth. Next. So here is the typical format that no matter who the funder is, will have something like this. They may have different wording. They may have an extra, section you have to write, but almost every funder will have something like this. What's your problem? What's the problem you're trying to solve? So they'll call that statement of the problem or statement of the need, but something that starts with, what is it you are trying to address? Sadly, these are usually more negative focused. They're usually where you get to put your more strength-based things. I'll show you a couple places where you can do that, but usually there's a limited amount of resources that the feds are going to give out or the funder is going to give, and they want to send it to the highest need. So usually this is where you demonstrate your need is critical. And so that's usually the first section. Then the next one is, what's your proposed approach? What are you going to do to fix that? What are you going to do to address that need? And so it might have lots of different names, but it's basically, sometimes it's called approach methods. It has a different name, but it's like, what are you going to do about it? And then the next one is your organizational capacity. Show us that you have the capacity to fix that problem through the approach that you just told us you're going to use. The approach is usually where you put your evidence-based program or practice or whatever it is, your culturally, relevant solutions to the problem. You usually put that in the proposed approach, and then your organizational capacity is, and your proposed staffing is to prove to them you've got the horsepower to get that done. And then this last one, the one here, performance measurement or evaluation. How will you evaluate your project to make sure it's doing what you said you were going to do? We are not going to cover that here. We're also not going to cover the budget. And those are two completely full-time things there, different webinars, if you will. Appendices, almost all grants have appendices. They usually want job descriptions, resumes, collaboration letters. By the way, a collaboration letter is not a support letter. Most grants will not allow you to send a support letter. A support letter is simply like, think of it as a cheerleader. The so-and-so tribe is doing a great job. We really like what they do. They really need you to fund them for this or that. That's a support letter. That's a no-no for the most part. A collaboration letter is distinct. A collaboration letter says, on behalf of the such and such school system, we are here to work with the such and such tribe to help them implement their program named so-and-so. As part of that, we are going to have them come every Tuesday and Thursday to run special classes for our high-risk youth, or they're going to run an after-school program. So but a collaboration letter is different from a support letter in that it's very concrete about what is going to be the relationship between who's writing the letter and your tribe. And it's always good to say things like, we have worked together successfully for the past decade, or whatever your working relationship is, so they know you're not cutting your teeth. You might have to be, maybe it is a new relationship. Maybe then you don't mention that it was brief. What we do in grants, we never tell a lie ever, but you can choose to highlight more positive information, maybe not go down too many rabbit holes if the information is not as compelling, but at any rate, so sometimes you have to also show what evaluation tools you're going to use. So that's a typical format. So you can start writing grants now using sort of these headers, even though there's nothing out there. Then when the actual grant opportunity drops, you're now really just, editing. You might have to change the titles, you might have to add, but you're not starting with a blank page. Okay, next. Okay, so I'm going to show you some samples now. Go ahead. And so here's a sample is a statement of need typically has this kind of information. And I want you to pay real close attention to the details here. And I'm going to, in a minute on the next slide, but what is the size and demographics of your population of focus? So you would say, we're going to serve Native youth 12 to 17. There's 1,200 of these or whatever in our tribe. Any special characteristics? Are the people you're serving all youth or all elders or a subset? Those with mental health challenges, or those that are at risk for suicide, or those that have had an opioid overdose, or what have you. The description of the geographic area, sort of what is the area like where you are? Is it rural terrain? Is it rugged? Is it urban? Is it is it isolated? Just what is that like? A brief description of the barriers. You have to take an airplane to get to treatment or whatever, it's a long distance. Our tribal members don't always have transportation. What are the barriers? What are the data sources that support your need? It's very important that if your tribe has a strategic plan and the problem that you are trying to solve with grant funding is mentioned in that strategic plan, take a little picture or do a little excerpt and put it in a text box so that the grant reviewer knows, hey, they're not just chasing money here. This lines up with a need that tribe felt so strongly about. They included it in their strategic plan. So that lets them know this is responding to a real need. Next. So this is real text out of a real funding opportunity. And what happens and why most people don't get the funding that they seek is they will look at, these are what I call prompts. Okay, so section A is called population of focus and statement of need. And it tells you how many points you're going to get and how long it needs to be. In this case, 1 page. Identify and describe your population of focus and the geographic area where services will be delivered. Provide a demographic profile of your population of focus in the catchment area in terms of race, ethnicity, the federal recognized tribe, the language, the sex, the gender, the sexual orientation, the age, and the socioeconomic status. Most writers skip all that detail and they just put in a general statement. Oh, our population of focus is elders, that are on medication for opioid or on opioid medication for cancer and other health infirmities. There are, 100 of such individuals that we'll be working with, period. They don't say, well, how many are male? How many are female? What age group are they? Younger elders, older elders, what language do they speak? Are they poor? Are they wealthier? Do they have the wherewithal to get to where you want them to go? Are they too spirited? So you really need to read every single word in the prompt and then make sure you find where you answered it. Think of it as a job description. You're applying for a job and it says, what is your name? What is your address? And what is your phone number? And why most grants don't get funded is they'll put the name, but they don't give you the address, or they give you half an address, so it's that concrete. And then describe the extent of the problem in the catchment area, include information on unmet needs. So, I even pepper some of those words back in. The example of our unmet needs are. That way the grant reviewer, it's like, you don't want them to be like on the, on a, what is it called when you scavenger hunt? You don't want a grant reviewer to be on a scavenger hunt to see, did you answer the question? So, I try to pare it back a little bit of these prompts and then answer it so that it's easy to find. And they want you to identify the source of the information. Here's an example of a graph that I used recently in a tribes grant application, where you can see how many are male, how many are female. All this came from the tribal data system. And you see the language, 100% speak English, 20% speak the tribe's language. And then this could go on, well, it already did. How many are two-spirited? These were estimates, about 20%, but it's your data, it's your story to tell. You provide the information, and then you put the source is your tribal stakeholders or your tribal leadership or your tribe's data system. Some of these you may have to estimate because a lot of data, for example, two-spirited information is not always gathered. I know nationally between 6 and 10% of general populations would be considered gay, lesbian, transgender, two-spirited, about 6 to 10%. So you can apply that against your tribe to answer that question. However, I want you to think about this important thing. So remember, you've got a general population and you have a subset, okay? So the general population is everybody, but the subset you might be trying to serve are individuals, let's say, with a behavioral health challenge, okay? Well, if the general population is 6 to 10% gay, lesbian, transgender, two-spirited, however you name this population, the characteristics, then you would know that probably individuals that are struggling with mental health challenges or drug use, they're more likely to have a higher percentage that would be two-spirited, because there's a lot of reasons why people seek substance use or have depression or anxiety. And often it's because they're being stigmatized for how they identify, or they're not being accepted by their family and friends. And so they use substances, or they have depression or what have you. So remember that when you're estimating, it's your number. You just say where it came from, and it needs to be able to be defended. Not that people ever come in and count, but you have to say, we know that about 10% in the general population identify this way, but in some informal discussions among our tribal members, we estimate that it's really twice that within the population that have challenges with mental health and substance use. Next slide. So again, I come back to charts and graphs and pictures, say 1,000 words. This is a real data where we were looking at suicides by the particular region of a state where there was a particular high-risk population. And where you see the red were where there were the most suicides. So this shows not only where are we going to focus the program, but we put a big arrow. This particular community is going to be a high priority. So this is just, and you can go to the next slide, but just there are ways that you can show data, show the geographic area, because you're not going to have a lot of room often to go into as much description as you would like. So I'm going to give you a real example here. So a tribe, I used to write grants 20 plus years ago, primarily in New Mexico. And so let's say this tribe in New Mexico decides to seek funding for a mental health promotion grant to serve children in their community. Now let's look at what is next slide, what a good example and a not so good. So this would be, and this is not obviously the whole answer. This is a tiny little excerpt that would just give you an example of maybe what not to do. In a national survey of exposure to adverse childhood experiences, 11% of children were found to have experienced, these ACEs. Childhood experiences, both positive and negative, have tremendous impact on future violence and victimization. We give a statistic from 2011 from CDC, Centers for Disease Control. As such, early experiences are an important public health issue for our tribal community. Okay, well, there's a lot of things wrong with that. and aside from it being boring. Next. Here's a better example, not perfect, but stronger. A survey administered to more than 1,300 Native Americans from New Mexico communities, including our Gallup community of Thoreau. I can't read what that is because there's pictures of y'all over here, but identified exposure to ACEs. And they can give examples. 29% of those surveyed had been exposed to 4 or more, yada, 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 yada. You see some of the data is 2018. While these issues are common to youth from other races and ethnicities, their concentration in our communities, coupled with cumulative burdens of generational trauma, put Native youth and young adults at even higher risk, yada, yada, yada. And you see that we got some of these data from focus groups from 2021. By the way, a focus group is just you pulling together a group of key informants or people in that are have lived experience, and asking them some key questions and recording their responses, not with their names or anything, and then being able to give that information back. So let's go to the next slide and see about the differences. So the weaker example was vague. It used national data. It had nothing to do with that exact tribe. It used older statistics. It doesn't address the population really that they're focusing on, whereas the stronger example was more specific, had tribal level data, even if it was what they gathered themselves in their own surveys. It was more recent. It had 2021. It specifically addressed the focus population, and it includes some barriers that, I don't know if it was historical trauma and other kinds of barriers. But you could strengthen that example I gave you a minute ago even more by providing a lot more rich detail about the population that you're trying to serve. Next. Other things you might want to consider in a statement of need is any differences in gender. So the other day I was writing a grant for the STOP grant for alcohol prevention. And I happened to be looking at the data, and I realized that when I analyzed it by gender, that girls were initiating alcohol use at twice the rate that boys were. And we know in prevention, if you can delay initiation, even if it's inevitable that kids will drink, the longer you delay it so that they're a little older, instead of 11, they're 13, or instead of 13, they're 15, the better your chances are that they will not develop a long-term problem. They might experiment, but they'll probably put it away and move on. So once we saw that, we said, oh my goodness, holy smokes, we need to make sure that whatever prevention campaigns we do really speak to the gender differences. And we need to find out, well, why are girls starting earlier? And we found out, interestingly enough, that it had a lot to do with social media and the feedback they were getting about their body and their appearance and their popularity, and all the things that girls sometimes care about and shouldn't. And so we now know our messaging really needs to tailor to that. And these are all the interesting nuances that if you know your tribal community the best, then these are the things you want to communicate. Next. And also your tribal strengths that you can build on. So consider charts and graphs, maps. We talked about this. Trends, trend data shows something's going up or coming down. Powerful quotes and text boxes. These are all important things to consider. Next. Okay, so here's the next section, the proposed approach. Again, we're still pre-application, but we're starting to write things down now. Next. So here's what's typically included in a proposed approach. Description of the approaches that you are saying you're going to take to address the needs that you identified in your section, in your needs section. I want you to think about the first two sections. If it's the first one is problem and needs, and the second one is your proposed approach, think of them as hand and glove. Whatever you describe in your proposed approach should be exactly addressing the needs you talked about in your statement of the need or your problem area. You cannot believe the times that I'll read a grant and they'll be describing one problem. Then they go and they talk about the program they're going to implement. And you're like, yeah, but what is that going to do about this problem over here? So I think about this. I'm a very concrete thinker. I'm very practical. I think about those little games that you have to play when you're in school where you match, and it'll have all these things in this column and you match it to this column and you draw lines to show that they attach. I literally do that in real life in grant writing. So I will even come up with a numbering scheme. And this is how I think I get so many of these. I might put it like problem number 1 and I put it as a 1. And number 2, like I just put a little parentheses by each thing in the statement of need. Then when I go to my proposed approach, I'll put this addresses problem 1, this addresses problem 2. Even if I erase those when I'm done before I submit it, if I'm over page limit or something, I know I've done it. And then I might have just a little abbreviation, a way to kind of show, or I will just simply tell the grant reviewer, you know, as you will see below, our proposed approach is in direct alignment with the problems I identified in section A. So anyway, you can read these are some of the things that go in here, but the most important thing for many of the funders is they want to know not just what it is you're going to do, what program you selected, but they want to know why. Well, why did you pick that one? And did you pick it? So Shirley and I are working now on a repository of practices, because there are practices that Native people developed by, you know, programs and practices developed by and for Native people that are very culturally relevant. Then there are practices, let's say like motivational interviewing, that may not have been developed by and for Natives, but are used effectively with Native populations because maybe they've been tweaked or adapted. Okay, so you need to describe, why did you pick this program that you picked? What's the rationale for it? And so, you know, does it address some particular health disparity, or does it address a particular barrier, or what have you? Next. Also, they often want you to include a mention of fidelity monitoring. So the best way to describe that is, let's say you were going to be implementing a program in the schools and that it had 6 sessions, module 1 through 6. And so, and let's say module 3 is supposed to be on peer pressure. I'm making this up, but let's say it was supposed to be. If you're the supervisor, you will periodically pop in to see, are your staff implementing the program as it was supposed to be? So if you're on week 3 and you pop in, then you look at the schedule like, okay, well, they should be today discussing life skills, but you pop in and they're not even discussing life skills. They're on, you know, they made something else up to talk about. You say, okay, Houston, we have a problem here. We are not implementing the program with fidelity. We were, you know, as it was designed, this worker has what we call wayward implementation. Another very important word to write down, wayward implementation. That means how you implemented kind of got off track. And so however you design your way of making sure that whoever's in charge of the proposed program you're going to implement, make sure it's doing what it's supposed to do, the little check-ins and the observations, maybe they're unannounced, maybe they're scheduled, I don't know that they care, but that you show you're on top of what is happening. They also, what is a big problem with grants is oftentimes they just tell you, oh, we're going to implement this program, but they don't tell you, well, how are we going to identify the people? How are we going to get them here? How are we going to make sure that they stay, that we retain them, and that they can keep coming back? You know, if you're implementing inside, let's say, a justice facility where they're locked in, obviously they can't go anywhere. You kind of have them hostage. But if you're expecting them to come to you, then you better talk about, well, how are you going to get them in? Are you offering incentives? Are you going to provide transportation? Are you going to go do the program in their home so that you know they're there? You know, how do you, and then how are you going to keep them in? And there's a whole science around how do you retain, you know, how do you engage them? And then how do you keep them? How do you retain them? And a lot of it has to do with making sure you are checking in and addressing any barriers that they have, that you're, you know, the ones that I always did. And when I ran outpatient programs is we always had our staff let the client know, you know, how much they appreciate them showing up. They know it's hard. They acknowledge it's difficult, how brave you are to be here and to tackle this problem that we're going to be talking about today. And then then you give them a reminder if they allow you to, hey, looking forward to seeing you on Tuesday. Are there any barriers that you're anticipating that would get in the way of your coming? I'm looking forward to speaking with you about, you know, did you get your application for the university in place? Like you remind them that you care about them, that you're there to help them come in. If there's a barrier that they need to resolve, you're there, and that you remembered them. They're not just a number. You remembered that they were worried about getting into a college, and you're going to talk to them about that when they come. There are lots of And really, most of these retention strategies are what we call good old-fashioned social work: being warm, being caring, staying connected, being helpful, looking at the whole family, and so forth. Next. Oh, you also have to have a timeline chart. We'll show you that in a minute. Okay, let me just check the time because I want to make sure we have time for questions. Okay, so here's a weak example of a proposed approach. We propose to serve Native youth for our 3-year project in prevention services after school. We'll be offered them the program every 3 months for new enrollments. The activities will last about 3 hours, Monday through Friday. Activities will cover general things like strengthening relationships and peers and help with depression. And we will adhere to all required activities associated with the grant award. Now, here's a better proposed approach. Stronger. So our population of focus is 50 youth annually who are 15 to 17 years of age. About 50% will be female, or 30% will be female. High risk for substance use or mental health. We're going to implement the XYZ program. It's adapted from, Project Venture, where this, you might not know what this means anymore because it's no longer there, but NREP is the National Registry of Effective Programs and Practices. It's no longer there, but this particular program made it to that list. It's sort of the gold standard of programs, and it's been adapted in this way for Native people, and on and on. We selected the model because it's proven effective with mental health and substance use and suicide, which is in direct alignment with what we told you we needed in our needs assessment. And this is another little trick here. And we say, and shows alignment between what our youth needs and what the program will offer, as seen in the following chart. You can literally make in 5 minutes a chart that shows, here's what our population is bringing, the challenges. They're bringing, risk for suicide, risk for substance use. Maybe you also talk about what their strengths are, that they're building, that they're bringing a belief in a balanced life, or they believe in the importance of their culture, or whatever you describe them. Then you go into the next column and show what component of the program meets those needs. Module 1 and 2 provides life skills, which address this. Module 3 and 4 describes the importance of family connections, which address. So you can create on your own little charts that show alignment. And grant reviewers love to see that you have made it easy for them to connect the dots, that they're not having to do the big, hunt and peck and find and scavenger hunt. Next. So other important implementation details: how will you identify the participants? If we build it, they will come? No, that fails. Just because you have a new program and you announce it doesn't mean people flock, okay? And the funders will not fund you unless they know that you have a way to get these folks in through social marketing, through your referral pipelines. How will you engage them? Will you have peers go out? Will you offer incentives? Will you go out in the community and knock on doors? Will you bring the service to them? Like, how will you get them involved? How will you retain them? And how will you include what their perception of what's happening, and making sure you're always sort of agile in adjusting what you're giving to meet their needs, and that you're doing ongoing quality improvement in your program to make sure it always stays ahead to meet the needs of the emerging needs, because these needs change in communities. Next slide. Okay, so here's some timelines. We'll cover these real quick because we're coming into the home stretch here. Timelines next. They're typically part of a proposed approach. Sometimes they ask you to put them in as an attachment, but what a proposed approach, there's a lot of different ways to do timelines. So usually you have the key activities in one column, and then either the years, like Q1, Q2, all the way through year 3, 4, 5, however many years it is. Sometimes it's done a little differently. This one shows what the milestones would be. What's the next one? There's lots of examples. You can Google these and this is my favorite format right here, where you talk about what are the key project activities, what date, what staff, and how will you know when you've gotten there. Sometimes you don't have room to do the milestones. So most often a timeline chart just has the first 3 columns. But one of the things I wanted to point out is that on the timeline, if you think about it, even though there's no grant opportunity you're responding to right now, you can create a timeline right now, even though you don't know what it is. Why? Because we all know that there's certain key things you do, right? So the first thing you do if you got the grant, what would you do? You would notify your tribal leaders, your tribal members, you'd notify your partners. Hey, good news, we got this grant. you'd have a kickoff meeting, right? To get everybody together to make sure they're all on the same page of what we're going to do to implement this. You would start hiring your staff, right? So you're advertising, you're interviewing, you're hiring a diverse staff or the staff that align with the needs. What do you do when you have staff? You got to train them, right? So there's pre-service training, there's in-service training. You might have to send them to get trained in a certain evidence-based model. All of these things are steps that you would do. You have to go to certain meetings of the feds. You have to write certain reports on a certain basis, quarterly or annually or biannually. You have to evaluate what you're doing. You've got to review your evaluation to make sure that you're tweaking or continuous quality improvement on what you're doing. So all these things that you do, you can right now make a big list of those. You can turn it into a timeline, have it all ready. And then all you do whenever you're writing a real grant is you go in and you put your dates of and who's going to do it. And, and maybe make a few other tweaks. Next. There's lots of other templates you can be creating now, again, before the grant comes out, job descriptions, letters of commitment, sample budgets that, that you think would cover the grant. And you can tweak those and edit those as a real grant comes out. But there's so many things you can do now long before a grant opportunity drops. Next. So now we're going to pivot a little more to now, let's say the grant opportunity is available. What you're going to want to do is review the stated goals of the funder. And it's usually within the first couple sentences. The goal of the Tribal Opioid Response Grant is to reduce overdoses in tribal communities and enhance protection for tribal youth. I made that up, but whatever it is. Well, their goal has to become your goal, because if that's what they're wanting to fund, that's what you have to do if you want that money. So then you just restate the goal a little bit, that our tribe's goal is to reduce opioid overdoses and enhance protection of our youth members. So, you start working with their language to make it your language, to make sure you've got alignment between what they're funding and what you're wanting to provide. And I'll show you. So you look for what we call logical goal themes. I'm going to show you a logical goal theme next. So if you're writing prevention, because I know we're doing this through the prevention, so I put a little seatbelt as prevention, a little prevention goals. Almost all prevention grants recommend this kind of 5-step. First, you assess what are the needs. Then you build the capacity, the training, get your workforce ready, your partners ready to address the needs. Then you come up with your plan. Okay, what are we going to do? We got all our data. We know what's wrong, what we need to fix. We know what our strengths are. We have our capacity. We're going to build that to make sure we come off as strong as possible with our response and have all the right partners. We're going to create this plan of how we're going to, like an implementation plan, what we're going to do. Then we start implementing, and then we evaluate. Is it working? Do we need to tweak it? Do we need to make a continuous quality improvement? So you may have, as an example, in a prevention grant, 5 goals. Or maybe better yet, these would be objectives. Maybe the goal is to reduce opioid use. Okay. And how are you going to do that? The specifics are the objectives, assess needs, build capacity, plan, implement, evaluate. Next slide. And then you have all kinds of little steps under there. Here's an example. So goals are broad statements of what you wish to accomplish. And they're generally not detailed. So a goal is like aspirational. It's like a wish. Increase substance-free well-being among members of our tribal population. Okay, the goal is that broad typically. It doesn't tell you how you're going to get there, but objectives have to be time-bound, quantifiable, measurable. So an example of an objective for, goal number 1 is to increase substance-free well-being. An objective, goal for goal 1 might be objective 1. By 9/30/22, hire a Native outreach worker. By 10/30/22, conduct tribe-wide outreach to schools, community centers, tribal households to promote the availability of gathering of natives. This is a particular model that I was talking about here. Objective 3, implement the culture-based so-and-so. So really and you go to the next slide, these are, you're just going to kind of lay out. And of course, whatever you have as your objectives and your activities and whatever, all should be in your timeline. did you hire your staff? Did you conduct your outreach? Did you do all these things? And whose job was it? And when were you going to have it done? So what you want in a grant is you want all this alignment in every section. Okay, this is the last section we're going to go through today. And this is called organizational capacity staffing. And that's where they want to know, how long have you been around? What have you done? What's your experience with similar projects? Sometimes they ask you, what are your partners that you've included? What is their experience with similar projects or similar populations? This is your chance to brag. Have you had some special certifications? Do you get recognized? Do you get ribbons for best in this or that? Have you gotten awards? Who are your staff? What level of effort? Oh, by the way, have you had sound financial practices? Have your audits all been favorable? This is your bragging section where you're trying to give your funder really good assurances that they're going to bet on the right horse here, because you know what you're doing. You've got all this good stuff. Go ahead. A weak example, XX tribe is federally recognized pursuant to the Indian Reorganization Act of 1934. Reservations in rural New Mexico, our tribal partner with this, that, and the other, will hire staff to carry out this project. See attachments. Our project director will have responsibility for managing all project activities. Kind of weak. Next one, a little stronger. Our tribe is federally recognized pursuant here. The reservation is in rural New Mexico. It includes square mile of this many communities. The tribe's governing body is the so-and-so council. Our tribe's mission is so-and-so. It's carried out by 4 divisions and 7 departments. Our proposed project will be managed under this certain division over here, the Human Social Services Division. For more than a decade, our tribe has provided a wide spectrum of evidence-based behavioral health prevention. Here's some examples. We've implemented XYZ programs. Our proposed project seeks to expand our current school prevention program to include programs that promote a balanced life consistent with our native culture. We have longstanding partnerships guided by formal MOUs, yada, yada, yada. So a lot more rich detail in specifics. Next. It goes on, the stronger one, the project director will lead weekly staff meetings, which will include the project director, sometimes telephonically. We'll be covering an implementation plan to make sure we're on track. Wayward implementation will be promptly corrected. We'll do mid-project adjustments when needed as part of our continuous quality improvement. We'll have weekly staff meetings with the project team to review our progress and our project participants. With project participants, we will participate with our partners and ongoing quality of care meetings, to make sure everybody's on the right page and so forth. Again, rich detail of, what does implementation look like when you get the money? Here's an example of a proposed staffing chart. This is really one tiny snippet here, but you can see who is the proposed staff, what percent time, how many years experience, what is their role. And again, making sure you hit every single prompt that the grant funder has asked for. Next. Here's another way of laying that out, but there's lots of different ways to show, but they want very specific examples. This example can be found from that link there that Noah gave you earlier of that really great resource. And you can see all kinds of examples of these things I'm speaking about. Next. So the weaker example was very vague. It gave no examples of any projects that were similar that the tribe had implemented. It did not have a staffing plan. The staff roles were not clear. The partners weren't described, no project management plan. And of course, the stronger example had all of that. Next. Last considerations here for organizational capacity, the actual number of staff, their job descriptions or their resumes, what is the recruitment process? I like to say we will recruit our staff from a file of ready applicants, meaning that you're constantly getting applicants. And so you've got it all there. So you can make a pretty quick decision about who you're going to hire. You're not like scratching your head. Oh, I guess we have to advertise. Well, where will we advertise? What do we do? That you like let the funder know, hey, we already have a bunch of applicants on the ready that we'll pull from their applications, and maybe we simultaneously run an ad, but we're at least beginning right out of the gate. You talk about whatever staff training and pre-service preparation you're going to do to make the staff ready. If you're implementing an evidence-based model that they have to be trained in, make sure you mention that. And then also often in this section, they want to know how you plan to sustain all or part of your project should it be funded. Next. So you're getting it done. Now, the last 2 slides after this is, let's say you got it. You are moving along. You got your grant, you did all the things we talked about and more. And now what do you do? What are the key things you must do to keep implementation on track for successful and sustainable effort? And these last 2 slides will happen, and then we'll take questions. So let's see what we do to get it done. First, you hold a kickoff meeting, right? Because you got this brand shiny new project you're excited about. And so you'll have key tribal leaders. Hopefully your tribal leaders will come, because that shows how important it is to the rest of the community. That sends an important message. You're going to want your partners. You're going to want people with lived experience to know help is here. We got programs here that are coming, that are now funded, other stakeholders. By having that kickoff, you've maximized buy-in, because you've gotten them there. They're now invested. They're there when the baby gets born, and now they're going to raise the baby together with you, right? Because you just got funded for that baby's growth. You're going to use the timeline that you turned into the grant, either as is, to say, hey, we said we were going to start interviewing on June 10th, and today's June 15th. And how many people have we interviewed? We got to get on that. We're late here. You either go down your timeline at every staff meeting. You don't just turn it in the grant. You print it out once you get the grant and use it as your timeline. Or you modify it and add a lot more rich detail, because the timeline, most of them only let you do 1 or 2 pages, and it really might need to be 4 or 5. So maybe once you get the grant, you put a lot more detail in there, and you might kind of morph it into, instead of a timeline, it might be more of an implementation guide or an implementation plan with more detail that you then follow every staff meeting. How is this going? Are we on track? And so forth. You have regular staff meetings, in person or virtual, and also with your partners. Maybe you meet with your staff every week, and you meet with the partners once a month or once a quarter. Depends on how involved they are in your project. You ensure that you have sufficient community education. And I want to tell you that a lot of times there's so much stigma on the issues that you will write a grant for, that the community members don't always understand. Why are you doing harm reduction, or why are you proposing using a certain medication for opioid use? And so you'll get a lot of pushback and a lot of resistance if you don't have a lot of community education to keep them growing with you in your program, and for their acceptance of the project. And then again, making sure you have plenty of training, ongoing training, to make sure everybody's staying on board with what's happening. Next, and this is our last slide. Ensure sufficient outreach to maximize participation. Are you getting out there? And by the way, we have created a ton of really amazing posters that are free that you can download. We got 6 new ones that are coming to the university this week, that are using culture-based, and Shirley helps me with these. We work together as a great team, coming up with these really fabulous, meaningful posters that basically that are consistent with tribal values, and that have a place for you to put your own agency name in there and phone number, or even in your own tribe's language, to make sure that you're getting good, that you're sending messages. And these posters can go in schools and in laundry rooms, laundromats, and where people congregate, to let them know that that help has arrived and you're a phone call away, and please reach out, and it's not your fault, and trauma is affecting you, and so forth. So you want to make sure that all of this is being done, that you're really reducing barriers, that you're gathering perception of care, your satisfaction of the people, and not just the satisfaction of the clients or the participants, but of the referral sources and the funder. Are you happy with what we're doing? Are we meeting your needs, or do you have any questions? Making sure all your reports are good, that they're on time, that they're informative, that you're using the information that you're getting to populate that. Use your evaluation, or what we sometimes call performance assessment, to make sure that you're looking at the data. Like, we looked at some data the other day and found out that we were succeeding a lot with a certain age group, the younger ones, but we were failing miserably with the older teens. that's important to know. So we don't know how to fix it. So what you do when you get data that shows something isn't working, so data will tell you what happened, but not why. So now we have to go out and do some focus groups with older teens, like, hey, what's going on? How come this program, you're not coming anymore? Or that you seem to not be, enjoying it. What can we do? How should we change it to make you want to come, and so forth. Also make sure you're updating your tribe strategic plan with any of these new successes and lessons learned and all of that. Make sure that if you have a chance to get in the gray literature, which is just in people's, guidance documents or newsletters and websites and also in journals, if you can get in, that's not gray literature, that's official literature, but getting in journals, going to conferences, promoting what you're doing, getting a lot of recognition. That's how you keep the project sustained. So we'll stop now. Next slide for questions. And I know we've covered a lot. There's just, again, this is a 2.5 day course in, Reader's Digest Cliff Notes version. So I don't know, Noah, I can't ever monitor the chat box whilst presenting. So do you have anything that I need to answer? Or do you want to open I know we don't have that many people, but to open people's lines, or how do you want to do it?
Yeah, I don't see anything in the chat box, but I think we can just welcome people to start asking questions. Feel free to either unmute or put some questions in the chat box.
I have a question.
Mm-hmm. Yep.
So when you do the regular training, like the one that it's 2.5 days, do you give the participants opportunities to like write a sample statement of needs?
Yes, absolutely. That's what makes it so effective. They go and we break out in small groups. So we train, we might take a half a day just to do the statement of need. Then we ask the members to break out in a group and start writing. We give them some homework first. Come prepared to this training with these bits of information as best you can. Then we teach them how to do it, break them up in a small group. Then they come back and they present what they have. And then we critique that as a group, or there's different ways you can do that part to say, is there anything anybody can think of that would strengthen that paragraph, or that would, and so we work that way. And literally you can leave the 2.5 day training with a rough draft of an actual grant if you participate in everything. And if you do the pre-work, like kind of the homework assignment. But yeah, that's what makes it really, what this is that I just did is really so you understand the big picture of how complex these things are and all the moving parts that go in it. And so then, hopefully we were supposed to have the next one in San Diego, I think. Actually at a really cool native hotel in downtown San Diego, but it got canceled because of COVID. And I don't know if and when it's being rescheduled, and we only take like 24 people, I think, because it has to be small groups for everyone to feel safe about sharing their information. And it's all voluntary, of course, but that's a really good question. And to me, that's the best way to learn, by doing.
Absolutely. Yes. I know sometimes at some universities, they'll have a whole class on grant writing. Because my sister we went to the same college, and her class, she had to write a grant for, a sample company or a sample tribe. And then for her internship, she had to go work for a foundation. And then she had to review grants. Yeah. Mm-hmm.
Well, listen, whoever becomes a grant writer, you will be employed for the rest of your natural life, whether you want to or not. I've only lived in small towns once I turned 18. And I literally, in my small towns, I send my husband to do the grocery shopping because I cannot go to a grocery store without being pulled aside. Please, can you help our church, or can you help our tribe, or can you help our organization? And, because there's so few grant writers that have done this for long. So yeah, it's a great job. It's high pressure. I learned from doing, but I love that there's a school that actually helps people, because it's an important, connecting people in need with resources is a very important gift, an important service to provide. So we might need her name and phone number, Shirley. Or because I tell people if they call me, my name has been, my phone has been temporarily disconnected, just joking, because I'm like, how many more can I write, you know? But it's, you'll be in high demand. Has she graduated yet?
Oh, she's retired.
Oh, gosh, we missed our chance. Thanks. Should have mentioned that back when she was in there. I'd have loved to have worked with her because it's hard to get people to help with this.
It is.
Yeah. Any other questions, comments? And I know in advance, this is a lot to cover. The quickest I ever did it was 45 minutes, and it was like, you know, and it's, you know, it was even, and not obviously even in this depth, but it's a lot. But does this make sense, even to just kind of get the general components of how this goes and the importance of doing all the pre-work? Was any of this helpful? Or is it just only face-to-face?
So are you asking some of the participants?
Yeah, anybody, yeah.
So
Or you can
Penny
thumbs
showed
up or
herself
thumbs
and then
down, or
she
you
went
can
back.
thumb medium, if any of it was helpful.
So the ones that are left, can you answer? Can somebody answer?
And that's okay, if not to, let's see.
Okay.
Okay.
Oh,
What was
she
your
gave me
question?
right.
Oh, sorry.
The
Is
question
any of
was,
this information helpful?
Yes, I found it very helpful. I took down a lot of notes, and I'm interested in, I was looking at some grants, small grants that I want to apply for, and it was very helpful. Thank you.
You're welcome. And the small grants will probably be a lot easier than what we just went through.
Yeah.
What I went through is the only ones harder than the ones I went through is called a research grant, which is like, I don't even write those. They're very complex and you need researchers to write them. But the smaller grants, you can pick up definite kernels of what we covered today that will be very helpful in any grants, but it will hopefully be a lot less rigorous for you in the smaller ones.
What I liked about it was you were showing some of the stuff that you get for grants and how not to put out different things and what to look, you know, what to put out, positive things that you can get the grants.
Right.
You know?
Like the stronger, weaker examples.
Yeah. Will we get the PowerPoint?
Yeah. And Noah, I saw a typo and one other thing I want to change. So if as soon as we're done, I'll send you it within 10 minutes back. And then that, I guess they make it as a PDF or something and then post it somewhere. But Noah, do you know about that?
Yes, our communications team, I think, will make it into a PDF, and they'll send out an email that should include the PowerPoint as well as the evaluation survey, which I'm about to post, which helps our center continue to get grants and do the work that we do. So we'd really appreciate if you take a few minutes to fill out the evaluation survey that I'm about to put in the chat. Thank you.
Thank you. So we'll do one last check. Is there any other comments or questions, either Noah or Shirley? And before we end, I thought I saw one more come up, but it went so quick I couldn't read it.
oh, the question was, is it possible for you to do an extended training session virtually?
Sure. Yeah. The ATTC or MHTTC or PTTC would have to make a specific request for that, but yes.
Yeah, I'll share the link that we have a form for people to request TA, which would include maybe assistance on grant writing. So I'll put that in the chat. And this will just help us make sure that we're following up on any requests. So that is the link. You can also find that, I believe, on our website.
Oh, thank you. I saw that one.
Well done.
Thank you.
I concur. I took notes as well.
It's a lot.
It is.
A whole other world.
But
Yeah, when you asked me to do it, I'm like, are you sure? Are you sure you really want this? It's like making sausage. Do you really want to know?
When I do take notes, I feel like I get a better understanding of what I'm looking for, and then I can always go back, even if you send the PowerPoint, but it's more meaningful when you take notes.
Excellent.
Yes. Mhm.
Okay. Anything else before we close?
Do you want me to sing?
Your call, Shirley.
I would love to.
And I can stop the recording.
No,
Thank
you can
so much.
record this.
Oh,
You can record,
okay,
yeah.
great.
You can
Wonderful.
record the singing, it's just not the prayer. So, okay, I'm gonna do the water song. And it was created to honor the water and to give thanks to the water and to respect the water, because I'm sure most of you know that when we're in our mom's stomachs, we're in water. And that's how we live as embryos. And before we're born, we're in water. And then when we come out, we need water to live. And as we go forward with the next generations, they'll need clean water to live and clean water to survive. And so we all have to work together. All people, all races, all ethnicities, we all have to work together to help each other to survive, with the clean water and with the healthy foods that our people need to be strong and healthy. And so miigwech again to Pam for this awesome learning opportunity for our communities, because we need to look at what opportunities are out there federally and state and private, so we can help our communities, because our communities, we're still having many overdoses and many people in grief. And I think too, the water to me symbolizes the tears of our people and the tears of our women as they grieve the people we've lost. And I know, personally, I've lost people, and personally, I've lost people to COVID as well. And so this has been a really tough past couple of years for all of us, as we've lived through the COVID and this virus, and what has this virus taught us. And so I just want to sing this song, to honor our water, to honor Mother Earth. Nibe giza gegu gimi gwecho ni migu gijawe ni migu Nibe giza gegu gimi gwechawe ni migu gijawe ni migu Nibe giza gegu Gimi gwechawe ni migu gijawe ni migu Nibe giza gegu Gimi gwechawe ni migu gijawe ni migu. Oh, miigwech. Kishimanidu, miigwech, mama ki.
Thank you so much, Shirley.
Shirley. Thank you, everyone, for attending, and I will post the evaluation survey one more time. Again, that really helps us to know how our events are impacting our population that we work with, and can help us continue to provide valuable programming in the future. Thank you again.
Go get the money. Show me the money, everybody. Bye.